Studio 3 does operate what we would call an autism diagnostic service. Again, it tends to be tertiary level, second opinions, or for individuals that are having unnecessarily long delays in both the healthcare system and education. We diagnose people across the lifespan. I mean, the oldest person I've diagnosed, I think, was 82 years of age with Asperger's syndrome. The youngest, 4-year-old child. So those services are very much a specialism of ours. Most of our referrals come from word of mouth. They come from families, from other groups. But I think we have a particular approach, which we call the neurodiagnostic pathways, which kind of reflects our approach to diagnosis. And one of the first questions of that is whether you need a diagnostic label or not. Some people don't. Some people know they might be on the spectrum, for example, but also don't want other people to know. I had to explain to somebody fairly recently that autism is not a notifiable disease to the Department of Health. They really thought it was, and that if we diagnosed them, we would have to report to their GP the information on the diagnosis. That is fundamentally a misconception about diagnosis. If I diagnose you or another individual, then that's between us and you for something like autism. Increasingly as well, when we talked about neurodiagnostic pathways, people have multiple conditions. Now, as psychologists, it's not our realm to diagnose multiple conditions, but we do provide advice and diagnosis around ADHD, attention deficit hyperactive disorder, a term I really hate, pathological demand avoidance. Those areas become part of what we call our neurodiagnostic pathways. And the basic principles about these pathways is that we will receive often a referral. Sometimes those can come from different sources, but we will consider whether we can help or not. It's not just all about money either. It's about, can we actually complete a piece of work that other people are not doing? Increasingly at the moment, the waiting lists are so huge to get diagnoses that people are not getting services. It's a chicken and egg syndrome until they get a diagnosis. I saw somebody recently who was waiting 4 years, a child with severe challenges in a school. The teachers and staff want to help that young person a bit more, but the delays in the diagnosis meant everything was on hold. And in the meantime, we've got a child who's disrupting classrooms, home, very challenging, very distressed. So those are the kind of situations that we would normally intervene with. So our neurodiagnostic pathways tend to fit a very traditional approach. We decide first whether the request is reasonable around a diagnosis, particularly for autism, we have a number of specialists who do work in that area. After we decide whether that's appropriate, then we create our own individual pathway for that individual. Now, for some individuals, we need to have more observational assessments of those individuals. For some, it's less. Most individuals, though, we have to look at their developmental history, their milestones, then we have to look at their current functioning. And what we're trying to do a lot of the time is get an understanding of the individual's thinking styles. Autism isn't really about a collection of behaviours as you see on Rayman and social media. It's about how you think and see the world. As we know, it's a difference. A bit like different countries speak different languages. It is not about a deficit. So in the Studio 3 model, we don't focus on deficit models. The second area of that is if we go through our diagnostic tools, and there's a number of standard ones we use. After that, we come to the decision about whether this person meets the criterion. And usually another critical friend diagnostician, 2 diagnosticians in Studio 3 will consider that. After that is not the end of the process, because the third part of the pathway is we do not just want to give someone a diagnosis and leave them there. So all of our reports, and this is something that I'm passionate about, have to give people meaningful signposting of what to do next about the diagnosis. Do you understand? Does the person understand this diagnosis themselves? Do they want to? Has there any other implications? Do they want to keep the diagnosis private? After all of that, we create a pathway for people. And that pathway will talk about what the person needs. If they've got an issue with anxiety or they've got issues in public settings with other conditions, part of their condition, then we will help them with it. At that point, we'll also signpost them towards an awful lot of self-help organisations, mostly run by the neurodiverse, that we have affiliations with. So it's quite a long process. What's happening at the moment too much is that people get a score or a piece of paper. I've seen someone who had a diagnostic letter that was 1 page long. I mean, show some people some respect sometimes and some courtesy to say, this is why we think. This is why we think this would help you. So one of the things for our approach is that we very much want to focus on not just a label, but how does it help the person? How does it help them? The last clear area around our neurodiversity pathways is that we take a strengths-based approach to autism and other conditions. I'm not really just interested in people's deficits. What I'm interested in is what their strengths are. There's somebody I know at the moment who's an engineer. He might not be the most social person you've ever met on the planet, but he's a very effective engineer. So it's actually looking at what your strengths are. Do you have sound sensitivity? Not necessarily. You have super acute hearing. All of these are part of the changing approach to autism and the whole neurodiversity movement. So I feel really strongly that in our pathways, that's start to end of receiving something. There's also a whole group of people who have a diagnosis already that have no pathways. And often we were increasingly getting referrals from those individuals to say, I have this diagnosis, I'm pretty convinced I have it, but I'm not sure what help I need and what support I need. So we are specialist, we are niche. Our role is, I wish we could, deal with the huge problem and at the moment about demand and supply of diagnosticians, but I think we can help in ways along that pathway. So our service around autism is very much a service.